Hello guys, welcome back to another vlog. If you don't know me, I am Dr. Shreya Datta. I was an FMG student from Tver State Medical University. Then I did my internship from RML Delhi and now I'm first year PG resident in anesthesia. This is a new chapter in my life and like I promised, I will take you through my journey every step as an FMG student and this is the next step. So if you've been following the past few vlogs, I've been talking about renting a place in Gautamnagar and how you can go about your day, how to find libraries, and also I have shared some live study videos from libraries in Gautamnagar when I was preparing for my NeetPg. And then in my last vlog, I also told you that I need to pack and shift, but I don't know where I'm going yet. So finally, I found out the answer to that last week when I came to take admission here, and then I also went for a short weekend trip before finally joining here on 10th of Feb. So I went for my weekend trip to the very famous Kumbh Mela, which happens only once in 144 years, and so many people from all over the world have specially come to see it. So I'll insert some of the clips, and in this video I'll mainly share my experience as a first year PG resident in anesthesia in this first week of residency. So grab yourselves a cup of coffee because this video is going to be long. This is my hostel room from where I really enjoy the golden hour, and this is my bed. I decided to get myself a cup of coffee. Talking about my Kumbh experience, I got stuck in the world's largest traffic jam to get there, and the experience was completely worth it. Welcomed by lush green fields of plants, Prayagraj was absolutely stunning. And finally, we reached the Triveni Sangam, or the point where everyone believes that taking a holy dip rectifies all your past karmas. Coming back to our college, my duty starts usually by taking out the medicines that we would need for that particular anesthesia. In this video, I've taken out for general anesthesia. Rubbing in, our main work is to set up the OT and check the anesthesia machine, whether there is any leak and whether all the instruments are perfectly compliant. We have to also gather the equipments and keep them ready. So here we are just checking manually all the systems of this particular anesthesia machine, but there are also machines like Dragger which do the tests automatically. After checking the machine, we have to pull out the drugs that is needed for that particular case and load them in injections and keep them ready for administering the anesthesia. Here we are checking the Bain circuit manually. Hey guys, I just got back from duty, and as you can probably tell, my hair really needs a good amount of oiling and shampooing. And I also explored the supermarket out here, which was not a disappointment because I got pen, marker and a healthy skin moisturizer. So I'm going to try that out as well. And right now I'm thinking of exploring the gym in our campus, and also today I prepared the injections for the first time, and I also pushed the injection anesthetic in the patient's vein. I also cannulated a patient, so it was quite an eventful day for me, although there were only 3 OTs today that were lined up, for which we had to primarily set up the OT and check the anesthesia machines and also monitor the patients, of course. And all the 3 OTs happened under spinal anesthesia, and yeah, so that was most of it about my day today. And we were briefed about the importance of Quincke's needle and Whittaker's needle, process of spinal anesthesia, what is the importance of the hub and the bevel of the needle. All that I have to look that up and start making notes, for which I just got my hands on a pen and a marker from the local supermarket. So after a little bit of rest, I'm going to start making notes from video lectures on YouTube. Guys, I changed into my comfy clothes. So I thought before I end the day today, I'm going to give you a rundown of some important topics that we discussed, like short notes. You can make short notes of this topic to begin with in your anesthesia residency first year. So first of all, starting with some scales like the Malampatti grading, GCS, ASA and METS. These should be on your fingertips. Other than that, we also went through some essential medicines that we are required to set out on a daily basis. So you got to remember their names, and you also got to remember which ones are required in both spinal and GA, and which ones are specific for GA, and you got to remember their doses and how you're going to prepare injections with those medicines. So that was the second short note, and the third one would be about BLS, and the fourth one would be about fluid calculation by the Holiday Singar formula. And another important thing that we discussed during our last week was the anesthesia workstation and intubation specifications of the laryngoscope, particularities of spinal anesthesia, the layers of the spinal cord that we pierce during spinal, and these were mostly the topics that we discussed during the first week itself. And I just have to look up all the medicines that I take out on a daily basis, go into the mechanism of action for a better understanding, and you got to keep revising them to build that kind of muscle memory so that you can just load them and even unconsciously label them correctly with the dose. As we reach the OT, we do the leak and compliance test, for which we have to flush oxygen through all the tubings and check for patency. And the machine gives you instructions to go about this test. You just have to follow through and check if all the tests are passed. Hi guys, it's Sunday and I just started with my 24 hours duty. This is the DDR. Where I put my bag and bottle, and this is where I'm meant to sleep if I get to sleep at all tonight. Changing room and quickly change into my scrubs for the day. Scrubs pockets, you should always have cotton, electrodes, micropore, and different things that you might need in the middle of a surgery, so that you don't have to run from OT to OT to fetch these things. And I realized that I don't have a pen, so I went to the local supermarket to get a pen, and then I wrote my number in the casualty for casualty calls. Okay guys, so I just had 2 cups of tea since morning in my 24-hour duty, and right now I'm going to get the OT prepared for any emergency case that might come, and I'm just going to take you along. Here are some tips that I learned for loading injections without getting a cut. So it's best not to load injections with bare hands. Even if you don't have a glove, at least take a gauge piece to open the ampoules, to break the cap open, because it can be really tight and you can hurt yourself. Also, before opening, tap the cap. guys, so I'll brief you about my 24 hours duty a little bit. So in my last 24 hours duty, I just had one emergency LSCS call where the patient was brought in because her labor contractions were not adequate, and they decided to convert it to C-section, and it was quite easy. The process was done under spinal anesthesia. We just had to monitor the vitals, and it went by smoothly. So some essential things that we require for spinal anesthesia are the 4 emergency drugs, meth, atropine, ondansetron and glycopyrrolate. Other than that, we use the main anesthetic agent, which is bupivacaine. Sometimes we add additives like dexmed, etomidin, and of course we need a 25 gauge Quincke needle. So with these equipments, the spinal anesthesia was done, and we measure the point at L3, L4, the gap between L3 and L4, and then we put the needle right into the subarachnoid space for spinal anesthesia. The third one was for angiography and angioplasty, where we were meant to observe the patient while he was undergoing the stenting process, so that if his BP crashed, we could intervene and keep things going smooth. So we had to use noradrenaline to keep his BP stable, because there was a huge block in his RCA, right circumflex artery, and he had an inferior wall MI, 2-3 AVF showed changes in the ECG, and we put him on nicorandil post the stenting process. So currently he's taking NORAD and nicorandil, and we have to keep the NORAD maintained at a tapered dose till tomorrow morning and observe him till he completely stabilizes. Quite interesting to see how 2 stents were sequentially put in his long circumflex artery, and just when they were putting the stent one behind the other, there was a chance of his BP crashing, which we didn't let happen, and it was a good save. The last patient that I had to attend was of stroke. He came with a BP of 220 to 153, and we intubated him, inserted the Riles tube, got his CT done, where we found out that it was a hemorrhagic stroke, and his relatives decided to take him to another hospital. So we just had to correctly adjust him in the ambulance, and thereafter there were a few pre-anesthetic checkups to be done for today's operations that are lined up for today, and in that we usually check the patient's health system wise, take any known history of previous operations, drug allergies or allergies in general. We see the mouth opening by the Malam Patti grading. We do the ASA grading score and GCS, etc. So there are a few scales that we consider while doing the system-wise checkup. During the pre-anesthetic checkup, we also ask patients if they take medicines for hypertension or high blood sugar or any other regular medicine, and based on that we decide whether or not we will take in the patient for surgery for induction of anesthesia, and thereafter we give them the approval. And so that was done, and with that my 24-hour shift duty ended, and right now I have gotten my breakfast. I'm just quickly going to have my breakfast. Okay guys, so that was it about my 24 hours duty. If you guys liked this video or found it helpful, please do like, share and subscribe, and wait for the next one.